recording. So I'll keep an eye out for our waiting room and let everyone in, but so excited for this conversation today. I know we all loved hearing from Dr. Fine last time, and today we're really going to dive into what it looks like in practice to have a therapy animal team with you. So I'm going to just be watching for chats. Any questions that you have, you can put in. We'll get to as many as we can, but very excited to pass the torch today to one of our members to moderate, to Lori Johnson. So Lori has been a subject matter expert assisting in the creation of AAI for a long time. She spent 38 years in education and has worked with service dogs and in a canine in the classroom program. She's the founder of a canine ambassador program, is a pet partners evaluator. She has her certified AAIP specialist certification, and is just a wonderful leader in the field, providing consulting and help when people are looking to bring therapy animals into the classroom. So I'm excited to pass it on to you, Lori, to lead us through the questions today.
Thank you so much. Boy, did you ever make me sound fantastic. That was nice. Thank you for that introduction. I'm really excited to ask the questions and learn more from Dr. Fine. So the first one, how do you decide which clients to pair with which animals?
That's a good question. How are you, Lori? It's good to see you.
Thank
and
you.
we got just introduced to each other, and Lori is a fellow Canadian, so I got really excited.
Yes. Yeah.
As many of us. So it's neat to be here, and thanks all of you for being here on a Friday. Those of you who are on the East Coast, it's the end of your weekend. We're still sort of almost finished Friday, but what a nice way to end off a weekend, to start a weekend and end off a week by talking about this. So your question's a good question. And, you know, in the olden days, I always use that word, in the olden days, I had more than one therapy animal. So those of you that don't know who I am, I'm a faculty member at Cal Poly State University. So if I could do a plug for my university is based in Los Angeles County. It's part of the 23 California State Universities, and our university was endowed by Mr. Kellogg. When I say that, Mr. Kellogg in the early 1900s owned land in Southern California, and it was actually his Arabian horse center. And so by about 1920, some of the horses that were part of his group, they were all Arabians, they were in the movies, and Rudy Valentino, many of you may have heard of him, famous actor in the silent movie pictures. They started to encourage Mr. Kellogg to donate the land to the state of California. So my university is part of the Cal State University system, and as such, we're lucky because we have the Kellogg Arabian Horse Center, and so we have about 100 Arabians, including one that's my bestest pal that I go and play with all the time. So why did I tell you that story? I told you that story. I could say I don't know why, but I do know why. Is that my life is a mixed story, right? I'm an academic because I teach, I do research, and then my most enjoyable part of my day was always the afternoons, because that was when I worked with patients, afternoons until the early evening. So now I can answer your question. Although that being said, 2 weeks ago on August 31st, I retired from my clinical practice after all of these years. Although my wife says, yeah, I'm sure you really retired, because now instead of doing it every day, I share an office once a week with a psychiatrist, and I see some youngsters there. So I haven't totally retired, although it was learning a little bit new, because last Saturday was the first time the dogs came, and because it was a new environment, it took a while for them to get used to it. And we had to go through almost something that was a bit different for them, because they had really run my office. So to answer your question now, with my preamble, I have been working clinically in my own practice since 87. That was when I became a licensed psychologist, although I've been doing this work since the 70s, as some of you might know. So in the olden days, going back to that term, I had many different therapy animals. So I had dogs. I started off with my early work was with small critters like gerbils and bunnies and guinea pigs. When I opened up my practice, before I even started bringing in my dogs, I worked with exotic birds. So I had large cockatoos that I worked with, and had 3 of them, and had conures and lovebirds and cockatiels. I had a bearded dragon. So that being said, one of the things that I learned to do was, in the early years, I'd called it the Baskin-Robbins philosophy. You're probably saying Dr. Fine looks like he loves ice cream because he's pudgy, but I learned the quote from Irv Robin. Those of you that know the company Baskin and Robbins, Irv Robin once said that I have many, many different flavors. Not all my flavors are everyone's favorite, but I have a flavor that I know will be one person's favorite. So that being said, how do I know which animal works? So unlike other therapists, because it's a good question, Lori, because many people that do clinical work, they may just only have one animal. And so the Baskin-Robbins philosophy is a bit more complicated because you have only one source and you're hoping that there is a connection. And so in my work, number one, I'd have different therapy dogs working with me. And I got to know, for example, Emily might like heart better than shrimp, or liked PJ better than Ketsy. And I sort of watch their behaviors to kind of figure that dogs are the animals that they're really comfortable with. So I really follow that principle. In general, the one thing that I have to stress, which I know all of you know, especially because you're members of AAA, is the notion that the animals that I work alongside with all demonstrate all the competencies that you talk about. Affiliative nature is that when the dogs or the birds want to be there, they want to be there. They seem to be curious with the humans that they're interacting with. So the affiliative nature has to happen. They have to want to be there. So it's like, one of the comments I wrote in a book years ago was, you have to get the right animal for the right job. And so that's the first comment that I would write for you. But again, those of you that only have one therapy animal, it's a bit more complicated, because sometimes certain animals do better with children than they do older people. They do better with certain populations. So I think that really answers the first part of your question, Lori. I think that I want to make sure that when I had more than one animal, that I always would make a note that, for example, if I knew one person really liked one therapy dog, for example, I would make sure on their visit that therapy dog would be there. At one time, I'd have 2 or 3 therapy dogs in my office. It was much bigger. I always would have one of the birds there. And then, of course, the bearded dragon lived in my office, and so did all the different kinds of fish tanks that I had. So I think it's really important to recognize certain clients do better with certain populations. I can give you another example with a child that I worked with autism, for example. She couldn't handle certain noises or sudden movements. So different dogs did better with her as that consequence. I always had, when she would come, I'd have to use a certain shampoo that was very fragrance free, so that it didn't impact her behavior. So I think the question that you're asking is a good one, and it's a good one only when you have the opportunity to have more than one therapy animal. If you don't have that opportunity, I don't want to discourage anyone, but you have to recognize, as I tell lots of people, that sometimes the connection doesn't always work. And you know what I mean? I've had clients that, really, for some reason, weren't as connected to dogs, but when the birds came by, they really loved it. So you have to really be observant and conscious. Sometimes that comes with the interview process too. So I think I answered your question, Lori. I gave you a long-winded way and threw in my girlfriend, Amber, who's the horse, that I should show a picture afterwards.
Thank you. Excellent. So the next question: what, if anything, disqualifies a client from working with a therapy animal?
That's an excellent question. And again, My work is mainly with children, right? But I can give this answer right off the bat. So when people come to see me, for example, I specialize in attention deficit hyperactivity disorder, high functioning autism, so developmental disabilities and various conditions in childhood. So people come to see me because of that expertise. Now, there's a whole cohort of people that come to see me because some people say, I hear you're the dog person. They don't really know a lot about animal-assisted interventions, or they've heard a little bit about it. What would disqualify? So some families call me because of they see me for ADHD, but they're not comfortable with animals. So we talk about that because their child may have profound allergies. My office was much more difficult, although the office got cleaned twice a day in the olden days, right? You can't get all of the dander out. So if someone's really profoundly allergic, sometimes I could say we can maybe work in the front office. We'll see how that goes. So we look at health concerns. That would be one. One of the things I always want to make sure is children's history of relating with animals in general, and if they've been abusive to animals. I've had several children that I know that have had abusive histories with animals, and they have worked alongside me with my therapy animals, and I thought that was a wonderful way of making a connection in a humane way. However, there is a preamble of animal safety and animal welfare that maybe will be a question that will come up. So I am my animal's best advocate. Many of you have heard Yay Abba, but in reality, that although the term has been catchy since Pet Partners came up with the term, that has been something that I've endorsed all of my career. I am my animal's voice. And so my animals look to me for their safety. And so again, that would be a concern for some people. And if you're very clinically trained, you would know how to work with that. But for some people, when you have a client that has a history of animal abuse, you might say, maybe this is not the best time today, but it can be done safely and effectively. Sometimes there are cultural issues, right? Certain cultures aren't as comfortable with animals, and I'm very respectful of that. And so, but I've had families that come from cultures where, for example, they don't really feel as comfortable around dogs. But some mums and dads have said to me, but I've heard wonderful things about your dogs and I want to try that. And so we do this respectfully and safely. So from a multicultural standpoint, you have to understand that. You also want to understand if a child has fears around animals, unless that's the primary purpose of the treatment, right? That they want to work on a phobia, then that's one thing. But if a child is really, really anxious about animals, we don't integrate them right away, but sometimes they see pictures of my animals. In the olden days, you have to see, I had an office that was filled with portraits, pictures, paintings of various therapy animals over the years. So it wasn't like a hidden secret that we had animals in that office. And some of them were curious. And so we would introduce them slowly. And so one of my dogs that I could think about, she learned how to army crawl. And so when she would come to visit children that she knew were skeptical, I would look at her and sign that you needed to, I'll just use the word army crawl, and she would just gradually come in. So it's important that we recognize all of those issues. So fear, allergies, history of abuse, multiculturalism. There could be some issues that you would understand a child's history. So for example, a child who's recently lost an animal in their life. I need to know that, right? Because then my animal could be bringing up a whole new caveat of issues. So in the history that I take in the first visit, I always collect information about a child's interaction history with pets in their lives to get a feel of that. And then all of these questions come up. You know what I mean? I want to know about history. I want to know about abuse. I want to know about all of those things. So did that answer it, Lori, for you?
Absolutely. For me anyway, you hit so many of the things around fears and cultural issues. And yes, education, it sounds like, is what you were doing and getting them used to things. The third question, how do you prepare your clients for their therapy animal interactions?
Again, that's a good question. And in fact, I giggle because I think in some ways kids are more excited to come to my office early on because they know they're going to meet the animals. And so what was it like years ago? Could you imagine being a little child and you're waiting at a waiting room and all of a sudden a golden retriever and a cockatoo might come out together and tell you to come on back? But it often is when the golden retriever comes in and is sort of like the receptionist and kind of gets you ready. How do I work with new clients? We do have a series of goals. So number one, I explain to parents what animal-assisted interventions are right off the bat. It's easier for me because I have handouts that I've written. Many of you have those things. So when people come to see me, they know that I'm a cognitive psychologist, a cognitive behavioral therapist, but they also know that I have this very strong conviction on human-animal interactions, animal-assisted interventions. And I explain a little bit of why I do the work that I do. I think parents quickly realize it's more than a meet and greet with the animals, that for some kids, I might use the therapy animals for children that have OCD, that are very uncomfortable with cleanliness. And so they get really concerned about touching animals, but all of a sudden they want to engage with my animals. And so there are lots of ways that I have learned to incorporate the animals in that manner. So with children, just like when you look at humane education, and I think all of you would know this, that how do you introduce a child to petting a dog? How do you introduce a child to interacting with an animal safely? Well, we do that with all of my therapy animals. And it's really funny that sometimes kids, I'll give you an example, would say, well, what tricks does your dog do? And I let my clients know that my dog don't do tricks for them, that they're not there to be that kind of interaction. And it's also equally as interesting because one of the things that I do with my clients is sometimes, especially with the older ones, we take walks, and it's a natural way of walking because you're walking a dog. But sometimes when the kids want to ask the dog to do something in the walk, the dog often doesn't follow the child's command. The dog is looking at me and saying, what am I saying? And kids ask that question and I let them know, could you imagine if the dog had to listen to 10 people a day on telling them what to do, they would get really confused. So they get to know that if I give them permission to ask the dog to do things, then the dog knows that that's the person that he or she's paying attention to. We go through safe interactions. I also let them know when the dog wants to have a time away. It's not because he or she is not liking them, but they just need a little coffee break, so to speak. So we talk about safe interactions. That would also be a conversation about how do you say goodbye to a dog? So how do you say goodbye when you finish therapy? How do you end a relationship? And in a very difficult scenario, how do you deal with an animal that is chronically ill, a therapy dog that's going to retire or unfortunately passes away during treatment? How do you deal with that? These are all things that, eventually we talk about. And so I do an orientation with the clients on how to safely interact. I do an orientation to explain to the parents the role of the animals. I developed years and years ago my first consent form, which was that they signed that they were willing for their child to be involved in a complementary form of therapy. But in addition to that, if we were doing walking therapy as portions of that, I explain what that is, where we go, and how it works. So it's really important that they get the orientation. But I think if you ask the question, I think the most important part is the safe interaction and the safe greeting and teaching people boundaries, that these aren't toys or objects that you want to just grab onto. The animals kind of help with that process throughout the engagement.
What an amazing answer. Wow. What are some of the activities that you do with your clients and the therapy animals?
That's a great question, because if I said to you, I don't know, that would be a bad answer, wouldn't it? But you know what? I don't do certain kids, there are activities. And so that would be more of a prescribed treatment. So for example, I was involved in an R01 research grant, a very large grant funded by the National Institute of Health that was funded to Sabrina Shuck at the University of California, Irvine. And so we developed a treatment protocol for kids with ADHD. And so there was a very specific protocol. So we had reading to the dogs. We had a leadership training. It was called Be a Good Teacher, where the kids actually trained first therapy dogs that already knew how to do this, but then worked with service dog puppies so that they learned to be good teachers. We did some social skill training. There's a whole curriculum on how to be assertive and positive in the way you relate. And we used lots of animal examples when they were good teachers. For example, we would videotape their interactions with the dogs, and the kids got to see how they were communicating and doing those things. We had humane education activities like being a pet detective, trying to observe behavior of what the dogs were doing or how the dogs detected what we were feeling. So that is much more of an educational purpose. And you know, Lori, I know that you had mentioned that you're an educator, and so that fits really well in that work. From a therapy standpoint, it really depends on the client. So let me give you an example. I had a bearded dragon that I worked with for years. She was wonderful. I always giggle when I think of Spiky. When I first got her, I didn't know much about bearded dragons, to be honest with you. And I had a veterinarian that used to call me for injured birds because I knew how to rehab birds. But she called me once and said, I have this baby bearded dragon that got its tail cut off by an owner, and it wasn't going to grow back, and they were going to destroy the animal. And so she said, would you like to adopt it? And I'll give you the cage and everything else. So I'll never forget this because I came to her office and the bearded dragon was smaller than my palm of my hand. And she'd have a cage and a heater. And my wife was, of course, going, here's Aubrey to sucker again, going and going to adopt a pet. But it was great. And I'll never forget, one day a little boy came in and goes, oh my goodness, Dr. Fine, you have a bearded dragon. Could I bring mine for our next visit? I said, sure, why not? So a couple of weeks later, I kind of forgot that I told him this, but he comes in with this big Staples box, like just a box that you would put paper things in it. I couldn't understand what that was for. And then he said, well, I brought my bearded dragon. So I'm sitting there looking at the boy going, well, wait a minute. He's bringing a bearded dragon that's supposed to be the size of my palm, right? And then he proceeds to take out this adult bearded dragon that looked like Godzilla to me. And I turned white like, and I went, oh my goodness. So, but Spiky grew up to be a wonderful therapy animal. She was just terrific. Again, there were a lot of precautions that we had to make sure with good, safe sanitation. So if you're looking at zoonosis, washing your hands, which I do with all my dogs as well. But one of the issues that Spike had, now you'll understand, like when I think of purposes, Spike was a bearded dragon that often became constantly constipated. And so the way I helped relieve her constipation, which I just learned, was one, I fed her a little bit of oil with a syringe. And sometimes you put her in a small tub of lukewarm water and rub her back, and it will help her release and go to the bathroom. Well, I treat many children that have encopresis, soiling issues. And so when a child would come in that has soiling problems, that's a very hard thing to talk about, isn't it? And some kids even try to avoid the topic and don't want to talk about the issue. But when I know that that's the case, often Spiky had some of these issues. So instead of talking about it after we might have visited one visit, they would come in and I'd say, hey, before we start, do you want to help me with something? And then they'd see me take Spike and I put her in this large Tupperware container with very, very lukewarm water. And then I would rub her back and they'd say, well, what are you doing? And I'd say that, sometimes Spiky, her tummy bugs her and she has a hard time going to the bathroom. But watch what happens when she feels comfortable. And then she'd go to the bathroom. And then you could see the eyes of some youngsters that go, wow, that's something that I have a problem with. And then we start to talk about it. Okay, so to answer your question, I look at the needs of every client that I see, and I determine levels of interactions. For some children that have communication difficulties, it's learning to talk to the animal or give directions to the animal that he or she has to follow. So there is a prescription that I think about. So it's almost like a process, and I've written about it in a couple of books that I've written, where I talk about how do you think about how to do this work. The serendipity of the relationship, like the initial things when you think of Boris Levinson, that the animal is that catalyst for conversation. Sure, we do that. When children are emotional, my dogs, when we talk about affiliative nature, are very conscious of that. So when children or mothers or fathers become emotional, the animals walk towards them. Again, we're talking dogs, and will put their head in their lap for consoling. I have children that have become so close with my therapy animals in difficult times. The therapy animal writes them letters. And I have a chapter in Afternoons with Puppy that just shows some of these letters, but the therapeutic letters, they may sound silly, but in reality, you know, I have had kids that were bullied. So one of my dogs wrote a story to a little girl about when she once went to a dog training class. Everyone was giggling. All the dogs were giggling at her because she had a hard time following, because she was really a little bit impulsive at first, but then she was the best in the class. And she talked about how do you deal with bullies. So I have writing letters. I have very specific things. I talked about OCD. I have children that have learned to overcome OCD just by being there with the animals. On the other hand, I've had kids that just needed the therapy animals to get over a hump. They needed to get over the hump of talking about an issue. And so the animals provided that stress reduction, anxiety reduction, fear reduction opportunities. The hard part that you have to realize as a clinician, and I'm sure many of you have experienced this, is how you don't get lost under the blanket of the dog. And what I mean by that is that sometimes, again, children and adults could change a whole conversation and just try to get you to do dog training or to talk about issues that relate to the animal and avoid different conversations. You have to also realize, and that's why I use the example of Fred Astaire and Ginger Rogers. I have learned over so many years, and my dance movements change with the different therapy animals, right? But you have to be able to work seamlessly with a therapy animal. You have to be comfortable with that. And so knowing how to do that, you don't find yourself letting children or adults hide behind that blanket, but to really be engaged with the animal in a therapeutic way. So what I basically do is the example that I talk about in the books is I use a sort of a therapeutic problem solving method. You know, what's the purpose? You know, tell me a little bit about the client. Then what can we think about that makes this a creative opportunity? Now, with some kids, it might just be reading with a therapy dog, and it could be reading a book that's very relevant to the subject that they're talking about. But do I have planned activities? That's what I started off with. I don't. And in fact, I think about it because my first engagement with my first therapy animal, which again, I grew up being afraid of animals, not having animals, and the first real work that I had was with my little pal that was a gerbil. And when I brought the gerbil to a program, I didn't realize that when I let a child hold the gerbil, I said, now you need to work on staying still because I don't want you to scare my little buddy. That boy looked at me and said, see, I promised you I wouldn't move. And that was the beginning of figuring out, wow, how can I think that way? And if I can use an example, you know, I think in the background, you see that I have the back here is actually one of my magic libraries. I'm a professional magician. And being a magician has always taught me to think outside the box. And so even in a conversation, my mind, as my mouth is moving and talking to you, I'm already thinking about the next thing I'm supposed to be saying, right? And so the reality is the magician is always 2 steps ahead of your eyes. And so I have learned to think outside a box to plan entertainment. And when I work with my patients, I've always thought about how can I better how I introduce or work on an area. So I combine lots of things like, today you hear about mindfulness and it's much more popular. I was doing mindfulness and biofeedback alongside therapy animals years ago. So that in reality, I was teaching kids with stethoscopes to listen to my dog's heart rate, who was lying right next to them, and to listen to their heart rate. And I would say, can you match the two? So again, that was way before people did this. You talk about people, the popularity of today, animals going to colleges. I could get you to raise your hands. How many of you have ever heard of dogs, therapy dogs going to visit college campuses? So I was doing this 30 years ago, and I even did a research. You know what I mean? So again, thinking that way allows you better ways to introduce and think about how you do this. But I have to say again, because I wouldn't do justice to this conversation without saying that everything I think about also always includes the well-being of those animals. So I will never put an animal in a situation that I think is uncomfortable. I've had people that, I would do book signings for books, and people say, well, why don't you bring your dogs to your talks and your things? And I go, well, they're not circus animals. They're not here for entertainment. Now, sometimes I'll bring a dog to a book signing if, in fact, I have maybe 1 or 2 people that are going to be with me, and they'll sit with the dogs and they'll read with children. But even when they read with children, I have guidelines. We can't have 12 children trying to pet the dog. If someone's going to pet the dog, you have to see that the dog has to see you to know what's going on. So again, the welfare of their being is crucial. So I think I answered your question in a roundabout way, because you need to think about this. The simple part is what I call AAI step 1, which is using that animal as a social catalyst. But you got to know what you're doing even then. But for sure, that's how Boris Levinson began. That's how I began in my own clinical work. And I recognized the strength of people coming in, because I even did a research study. This is going back probably in the early 80s, where I looked at, many people look at therapeutic offices and they say, geez, what does my furniture look like? The paint on the wall. I studied the impact of some of my fish tanks on changing the attitudes of people by just changing the lighting in a fish tank, which is called the U, and how with the fish tank water noise, because I had a waterfall in one of them, how it just made people just melt. So knowing those things, and for sure, when people would come in, some people became so relaxed. I've had mothers and fathers that have said to me, coming to my office is the most relaxing part of their week. Because when they would sit in that fish tank, it was like watching a wonderful view of the ocean. On the other hand, I one time had a group of fish that one parent said to me, I feel like I'm in my house. And I said, what's going on? And she said, these fish are fighting like crazy. It reminds me of my kids. And so again, that's a balance that you correct. I had a fish guy come in because I had fish consultants that would check my tanks and I would clean it, but they would come too, that we would balance the school of fish, that they were the most relaxing fish to watch. So I think I answered your question.
I had goosebumps when you were talking about the bearded dragon and the little child with the problems with that he didn't want to talk about. Oh my goodness. Okay. How do you capture your animal assisted treatment in your treatment notes? Or your animal assisted therapy in your treatment notes?
Good question. It depends on their engagement. Okay. Because again, if I'm talking about the complementary therapy, we explain exactly what we're doing. So for some children, for example, some of the therapeutic goals are built on their ability to work alongside the animal. So for kids that are working on cooperating, children that need to help follow directions. I've had kids that give the dogs directions and try to say to the dog, I need you to focus. So if the animal is directly linked to the goal. They're written in by explaining the goal of the intervention might be reduction in anxiety. And then I might say, this was done, and we would explain exactly how the therapy animal was integrated. So again, realizing that I'm sharing that I am a cognitive, I apply cognitive behavioral therapy. That in essence is the premise of the work that we do. And then I explain how the animals provide that complementary resource to it. And so it's very clear in the notes where the animals participate.
Do you mention AAT in your informed consent documentation?
No, do you remember I mentioned that I have my own form. So we have informed consent as a form in itself, what informed consent is. And then I have a special form just on therapy animals. So actually I have three. So I have one, what is AAI? And they write that they now have that information. We have one that says that they have a choice if they want therapy animals involved with them or not. And that's explained. And then I explained that with the older youngsters or older individuals, there are times that we take therapeutic walks. Again, I've never really walked with a client without an animal, but to me, having the therapy animal with me is very logical. Then, hey, Mystic needs to take a walk because she might need to go to the bathroom. Can we walk? So again, the kids think that we're walking to walk, but as you already can figure out, when we're walking, I kind of have an agenda of why I'm walking. I have different routes, for example, that we go shorter routes, more routes that have human traffic on it, so that I know we might bump into somebody that might say, hey, tell me about your dog, and that's going to have to get somebody to talk about it. So, and that has to be a consent form, not only with the parent, but we assent with the youngster as well, because I never would take a youngster if he or she didn't want to go. So if they don't want to go, we don't go. So absolutely, those forms are signed, and so there are three.
Thank you. Have you ever had to remove an animal from a session, and what does that look like?
Again, my animals are really good at doing this. Okay, so unlike a typical, again, in my old traditional office, right, there was a front room, an office room, and then I had two therapy rooms that were adjoined, and in fact, and then a patio, and my dogs could leave at any point in time. So that's something that I do a little bit differently, is that my dogs sometimes don't even ask me permission to leave. If they're not busy, they'll walk to the patio and just lie on the patio, and I don't care about the air conditioning. I leave the door open and they go back and forth. Answering your question, in my whole career, I'd say, and this is going back now close to 50 years of doing this, I think only 2 times have I had to prevent what I would consider a concern that never really was a concern. I really watch my patients very, very consciously in what's going on. And I really make sure that I have boundaries of where my animals are around. So I've never had an issue where anyone would act harmful or hurtful. I had a youngster that, I can think of a couple of kids that would come in screaming. And I do have one good example that I'll give you. I had youngsters that come in screaming, and I look at them and say, right now, you're scaring so-and-so. Let's make a choice. Either I'm going to have, let's say, Ketsi go into the back room until you can calm down, or this has to stop. And 9 out of 10 times it stops. So I think of one example that was fascinating. I had a young man that had a developmental disability, just a wonderful person that really, really loved these dogs. And he went through an experience that was pretty frightening for his family, that he became self-catatonic and chose not to speak. And he came in after days of experiencing this and sat on the couch. And of course, the dog that he really liked was right there. And first he didn't talk, and then he pretended and moved his mouth a little bit, but no sounds came out. And I, again, assessing your clients is really important. And I looked at him and I said, your friend is right here right now. And I know it's hard, but you're scaring her because she doesn't understand. And then he began to speak again. So I know these are aha stories. If you wouldn't have spoke after a few moments, I would have just said, stay where you are, and I'm going to bring the animal back. Had a young man, and I really think this is a wonderful example, who, again, very high functioning with autism, but had profound anxiety. And he came into my office very agitated at his mom. And so they were in the front of the room, front of the office, and they were arguing tremendously. He was banging his head on his hands, and out comes one of the dogs. And I said to him, no, the dog wasn't there, in fact, and he was all agitated. And I looked and I said to the mother, we're going to have to change this around. I need you to just move for a minute and let me see if I can handle this in a positive way. And I looked at him in his sense of agitation. I said, do you want Mystic to come say hello? And although he was agitated, he nodded that he wanted her. But I then proceeded to say, if she's going to come, you have to be able to bring this down. And as the dog came to see him, he immediately changed his demeanor. And the dog first put her paw on his lap, and I don't want to say rubbed his leg, but you get the idea. The paw was there. And then she put her head on his leg. But this was something that I've seen a couple of times with my dogs, and they were not really trained to do this. She then proceeded to walk around the couch, and then she hopped on the couch and lied on him, just like you'd see with dogs that are trained to deal with people with PTSD. And we were done. He was done in what we were dealing with. Let me plug in the computer for a second, because I realized the plug popped out, and so I need to do this before I disappear, and that would be really bad on this. So give me 1 second. So in essence, again, I'm very preventive in thinking. I breathe the Yayaba. So if you walk away with anything else you heard today, you got to be that animal's best advocate, because you're their voice. And sometimes, on the other hand, they look at me and say, we got this in control, if I can be anthropomorphic, and I let them lead with me. And so there are times that the dogs do things like that young dog that jumped on that boy, not jumped on, lied on him. It was probably the most therapeutic thing that she could have done. And she did it without me telling her. And at that point, the boy was melted. And I said, are you ready now to continue working? And he was. So I can share those things with you. So in all the cases, I don't ever want to put my animal into situations of jeopardy. So when I used to use my cockatoos, right, I don't hand a cockatoo to a 9-year-old child. And even if they want to pet my cockatoo, I always had my right hand near their beak. And so in all of the years that I did this work with birds, and I don't have birds anymore, none of my clients were ever in jeopardy, because we all knew what we needed to do. And so, when I had kids that had developmental disabilities that were a bit more awkward, we're not going to call it aggressive, awkward in their movements. Sometimes I would just sit on the floor and say, we're going to sit on the floor. And if you want to pet the dog, you know what we're going to do? I'm going to take my hand and put it on your hand. We're going to pet the dog together. So in this way, it's a gentle pet, but it's actually scaffolded with my help. So that way it works. So I think I answered the question, Lori.
Wow. Just so much good information. There's one more that I think is one that would be definitely worth talking about. How do you prepare a client to end services with AAT in mind? both when it comes to them completing their treatment and in the case of retiring an animal.
Or retiring yourself. So I could do this naturally.
Yes.
So I've written a couple of articles on retiring therapy animals. And so you could read those articles if you want. You can write me and I'll put in the chat my email. I'll do that right now, in fact, so that you can see that. So this is an area that I have been, I think it's there now, you could see it. This is an area that I believe that we all need to address all the time. So the life trajectory of a therapy animal, and when I use that word trajectory, you need to realize that there is a difference when an animal starts. There's a difference when they're in their middle of their career, and for sure there's a difference at the end of their career. So I have two dogs sitting right next to me right now. One is a beginner and one is really a veteran. And the veteran loves to go to work, but when she goes to work sometimes now, she sort of says, okay, I'm relaxing a little bit. I'll hang with you and then I'm going to take a break. We need to be conscious of that. And to be honest with you, we need to not be selfish, because many people that are handlers or therapists sometimes don't consider the fact that there is a point that an animal needs to stop working. On the other hand, the first dog I ever retired, her name was Puppy. She was a rescue dog. We had a party. In fact, the LA Times even wrote a little article about the therapy dog that retired. But I remember there was another therapy dog that worked with her. Her name was Hart at that time. And so Hart would come to work originally with Puppy to kind of get an apprenticeship. But when Puppy finally retired, and it was the day that she was no longer really going to go to work, when I left with Hart, a couple hours later, my wife called me and said, you need to come home. I go, why do I need to come home? And she said, the dog hasn't left the door. And so that began my whole writing experience. And that's 23 years ago, about retiring therapy animals. So I think, how do you retire therapy animals with respect, but recognize that working dogs, if I can use dogs for example, it's very different because they're used to it. So, and sometimes when you're retiring them, it may not be their choice. It's your choice because you think you're doing it in their best interest. How do you prepare? How do you get people to deal with that the therapy animal isn't going to be there? So in my case, how did I deal with retiring in general and having to say goodbye to many, many children? So I gave every child a gift, actually a compass, and said that, but it wasn't from me only, it was from me and the dogs, and let them know that we work together to be their compass on their journey of life. How do you say goodbye? How do you say goodbye? I had teenagers that were crying to say goodbye to me, saying goodbye to the therapy dogs. So you have to think about those things. I've written about how do you deal with euthanasia? How do you deal with the death of a therapy animal? And how do you deal with it for you? Because sometimes your bereavement then goes on and on and on and on. Because 8 months later, a client may have not seen you. They come back in, where's Puppy? Ah, there we go again. So how do you do that? So there are books that have been written. I have a children's book that I wrote because of that. Give a Dog Your Heart, Love Will Come Your Way was a children's book that I wrote just about how do you say goodbye and how do you celebrate the middle of life, which is that lifetime. So again, these are the issues that professionals need training in. So we almost come full circle with why I volunteered, because I love Pet Partners. I love the new organization. And in reality, one of the things that I've argued for decades is this isn't all common sense. Practitioners need a bit more training in the other side of the leash, because we may be good social workers, we may be good psychologists, we may be good teachers, physical therapists, occupational therapists, whatever. But how do you know how to work alongside a therapy animal? Because Lori, that question's a dynamite question. If you would have asked me that question 30 years ago, I would have, I never thought about it. You retire, but it's not like that. And for sure, how do you deal with your own bereavement? Because when you're talking about the passing of an animal, how do you deal with that? So there are classes. I offer classes on this subject. I know there are continuing education courses that you can take. There are books that you can read. But on the other hand, there's this, your head that you think about, and then there's the heart. And, I love science because I think science is helping us better understand HAI and AAI, and I believe in that. But Albert Einstein once said that some things that count can be counted, and some things that need to be counted can't. Because sometimes the relationships that we have with therapy animals are very, very personal and very unique. And, I have adults that come see me. I had an adult that came in a week before I retired. He's 43. I saw him when he was 17. I'm not doing the math right now. And he just said, I wanted to come by and check out the old doc and see who we have this time. I've had people that sometimes come by the office and they just stare at me and they go, do you remember me? And it's not in a rude sense. They just come back to say hello. So, teachers get letters years later on about why being an educator is valuable. I look at my life as being a wonderful journey, and these animals not only have blessed my patients from a professional standpoint, but these animals have enriched my life. So, like I said, I wrote that book, Afternoons with Puppy, as just a tribute to the afternoons I spend with these animals. So, I think I answered your question. I think that this needs a lot of attention. But again, especially when we're talking about the bereavement start, the part of a therapy animal getting very sick or passing away, as much as we have to think about our patients, we really need to look about how this impacts us professionally and how do you deal with this. And it isn't like you're going to run out. Years ago when an animal passed away, it was very acceptable to say, hey, I'll just go get a new dog. And some people do that. My animals have never been, I don't even want to use the word replaceable, because they're special. And I almost feel like I'm Coco when I bust into saying, remember me, because when you remember that special animal, and I'm looking at a person named Kamala who's smiling when I said that and then nodding. But the reality is, when you remember how special a being is, they become the fabric of who you are. So these are the things I have to tell kids. So when animals retire, I talk to them about this. I talk about, could you imagine when Puppy came back to work? It was quite cute. I told my wife, okay, I'll bring her back. And so we set up one of the office rooms as almost like a nursery, a special room for her. And there were times, because I told you I had this open concept, she would go into that room and then I would know she would be out cold. So I would even turn off the light. And when kids would come in, they would know, shh, we're going to go see Puppy. And they would whisper and they'd wave hello. And I'd always giggle when she would wake up. And then she'd march into the room and she'd look at the other therapy dog that was there and say, okay, little one, get out of my way. I'll show you how to do it. But she did that for the rest of her life. And she ended up coming to work partially, you know what I mean? I laugh because I'm sorry, there's a helicopter coming by. Not to come get me, by the way, they're just flying over. She would come to work almost to the end of her life, but I've had other therapy animals that have stopped earlier. I always giggle because my therapy dogs have drivers that pick them up and bring them to work. They come to work and they leave. They play like normal dogs when they're at home. So it's a real balanced life. And you have to realize, just like humans, you need lots of balance for a rich life. So I know we're going to run out of time in a couple of minutes, but before Lori asks the last question, what have you, it really has been an honor to be with all of you. And I'm excited about your career, because you are the new generation of people doing this work. And the more you ask these questions, the more you try to find your answer. See, I don't know what answers are, because some answers need to be your answer, not someone else's. You got to think through things. You need to know that when people say you're your animal's best advocate, you shouldn't really think of it as words, but you should believe it. You should believe that what you're going to do is in their best interest. So when it's in their best interest, hey, the animal needs that adjustment. What am I going to do? The animal's in a situation that's not comfortable. So I know I need to do something. I'm not going to let this go, because I've seen people do this. You know what I mean? How many people have I seen that have done things and I'm going, my goodness, you just can't do that. Or a therapist that once came to me and said, I have to tell you, I have a therapy dog. Great. Hates men. So when men come into my office, he growls and goes ballistic. I just tell him, don't take it personal. Well, let me think about that. You know, should you have that therapy dog there when men are there? Unless you want to prove a point. So again, it really is a privilege to be here. And Lori, I don't know if you have any closing other questions or if Taylor has anything to add, but I'll be quiet again.
Yeah. We are so lucky to have you as part of our community as we learn and we grow, and we want to do the best we can with all of this, and your years and years of experience, your books, everything that you have to offer us. We are just so grateful. Thank you so much for your time and all of your beautiful stories. I've still got goosebumps. I got to turn it over to Taylor.
Yes, and thank you so much, Lori, for asking the questions today and for everyone joining us on this Friday afternoon. These conversations are exactly why we're here at AAIP, and they will continue. We'll have one more conversation with Dr. Fine next month talking about moving the field forward. And if you are here, I imagine you're someone who wants to help carry the torch, further refine this field, make it more accessible, but also protect the animals and people involved. So we'll shift focus. If you have a question for that time together, email me. And we'll make sure that that is included. And we'll continue to have these conversations as a benefit to your membership with other field leaders into the future. So thank you so much, Dr. Fine. Thank you, Lori. I hope you all have a wonderful afternoon and weekend.
Bye, guys. See you later.